My name is Nicholas Mendez. I'm an exercise science student at Florida Gulf Coast University. For the last couple of semesters, I've been researching the benefits of aquatic exercise for the geriatric population and its benefits for clinical patients. This semester, I was an intern at NCH Cardiac Rehab in Naples, Florida. I got the opportunity to work with different types of patients with different pathologies and different goals. Our class sessions would range from 6 patients to 20 patients. We had 6 classes per day, and our age range from 40s to 90s. For my final project, I wanted to promote exercise as medicine to our patients by providing them with an exercise prescription that they could use to prevent detraining and to increase physical activity. The title of my presentation is Detraining and Aquatic Exercise for Cardiac Rehab Patients. I chose that name because, as we'll see through recent literature and from experience, patients who finish their rehabilitation program do not continue to exercise. The goal for my project is to provide patients an opportunity to avoid detraining by continuing to exercise, and to provide them with an exercise prescription that they can use as part of their training program, even if they decide not to join a gym or a wellness center. In this presentation, I'll share some of the literature that I came across concerning detraining and the benefits of aquatic exercise for the older population, and I will also provide a glimpse of my exercise prescription in action. It is essential for patients to keep exercising because the benefits gained from their 16-week session will slowly begin to fade if they stop exercising. This is known as detraining. Studies have shown that exercise can help fight the aging process, allow greater functionality for everyday activities, and improve health. Studies show that aquatic exercise has shown to provide the same benefits as land-based exercises. Therefore, it is highly recommended for patients to utilize this mode of exercise to keep them from detraining and to improve their health. I began my research process by finding statistical data on how many patients continue to exercise after their rehabilitation. Then I began to research what the effects were for detraining in patients. And lastly, I found studies to find out how aquatic exercise can be used as part of a maintenance program for cardiac rehab patients. The first study I would like to share is Exercise Training Programs and Detraining in Older Women by Olivieri and partners. The aim of the study was to assess the effects of exercise training and detraining. A 12-month periodization calendar was created with 9 months of training with 3 months of detraining. The researchers found that during 9 months of rehabilitation, there was a decrease in blood pressure, improvement in lower and upper body resistance, and an improvement in quality of life. However, after 3 months of detraining, there was a verified decrease in standing on one leg, increase in systolic and diastolic blood pressure, and resting heart rates. Therefore, a detraining period of 3 months after regular exercise training significantly increases blood pressure levels while other functional capacity decreases. In the study, the time course of changes induced by resistance training and detraining on muscular and physical function in older adults, Coetzee and Terblacci wanted to investigate the effects of cessation of exercise in patients who had to stop exercising because of issues with community facilities or chronic diseases. The study concluded that after a training period, the patients lost significant amount of lower body strength and loss of functional mobility. However, their level of strength was still significantly higher than the values obtained at pretest. This was an issue that Lee and partners wanted to investigate in their study. The purpose of this study was to investigate the functional fitness changes during a prolonged training and detraining period. 18 participants completed the 33-month study. At the end of the study, the researchers noted 2 things. First, that not everything is lost should patients stop exercising for a period of time. It was also concluded that there is a difference in time needed to regain functional fitness after a long period of detraining. The study stated that older patients should be encouraged to keep retraining until they regain the post-training condition in each of the functional fitness components. In the study by Adset and partners, they stated that attending a structured program as little as once per week was sufficient to maintain exercise performance. The researchers concluded that both aquatic exercise and land-based programs are effective as a maintenance program. So what are the benefits of aquatic training? Aquatic training helps increase speed, faster recovery, helps with flexibility, helps with controlled moves, correct posture improves power, strength, and balance. Nagel, Sanders, and Becker state, the benefits of immersion alone are numerous, particularly when clients are submerged in warm water. The combined effects of all water properties promote the aquatic environment as a highly effective medium to foster health, recovery, rehabilitation, health, fitness, and recreational outcomes. The study also showed an increase in peak power output when the older adults performed counter movement jumps in water rather than on land. So from these studies, we can conclude that to maintain their current health status, cardiac rehab patients are encouraged to stay active. Aquatic exercise training provides patients an opportunity to exercise without putting too much impact on their joints. Research has shown that aquatic exercise provides the same benefits as land-based exercises. Okay, we're going to start with our warm-up. You're going to do a forward jog, backward pedal 2 times, forward jog, backward pedal, forward jog, backward pedal. Next we'll do is our heel walk. So you're going to throw the heel all the way to your toe. We'll do that all the way down. Do the same thing going back, heel toe walks. Okay, next we'll do our heel walk. Now this time we're just going to walk on our heels all the way down. Once we're down here, we're going to do our ankle circles. Ankle circles. You're going to create a 90-degree angle on your knees. You're going to do 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Other side. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Going back, we'll do our toe walk. Next, we'll do our back low walk series. We're going to put your hands on your hips. You're going to create a 90-degree angle on your knees. And you're just going to go back. Going back, we'll do the same thing, just add an emphasis to the jump. So now you're emphasizing a jump. This concludes our warm-up. Make sure you take a water break, take a minute, and then when you're ready, we're going to start with our complex number 1. Okay. So for our first complex, we're going to do a squat jump, lateral run, and back run recovery. Hands on your hips. Feet are shoulder width apart, and you're going to do 5 squat jumps. 5, 4, 3, 2, 1. Okay. Then you're going to go lateral run. And for recovery, back run. And we're going to do it again. Squat jump. Second complex, we're going to do a lunge in place. You're going to have your right leg lead. You're going to do 10 on each side. And then you're going to switch to the other side, 10 on the other side. And then you're going to do a forward run. And for your recovery, you're going to do a back run recovery. Okay, we're going to 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Switch. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. When you're ready, do a forward jog. back on recovery. Reflecting back on my project, there were some things that I did right and other things that I could have done better. First, I found studies regarding long-term effects of exercise on cardiac rehab patients. I also came across studies that showed a time frame of how long the retraining period is for this specific population. And I also found studies that backed up my thesis on the importance of aquatic exercise. What I included in the previous section was a glimpse of what my exercise prescription contains. It is not meant to be an exercise video since my exercise prescription contains different reps and sets. As you might have noticed, I kept saying series for certain exercises because there are different variations to the exercise. I will include some footage that I was able to get to demonstrate what my exercise prescription would look like in the pool right here. One thing I would have done differently is to have our patients try my exercise prescription and obtain their feedback. For the future, I want to focus on incorporating weights in my program, and I also want to investigate the long-term effects of aquatic exercise on cardiac rehab patients that utilize this method of training as a maintenance program. From this project, I hope I was able to communicate with you the importance of exercise and to motivate you to continue to exercise. And always remember, exercise is medicine.